Okay, so guys, when you get started with care, we typically get you started with one of these, we call the cervical foam wedge. All right, so this is one of the things that's going to be really helpful that you can do on your own at home to help get that curvature back into the neck. I got to be honest, when I use this, it's relaxing, and it's really good because it counteracts like being on a phone or on a computer all day, putting your head into flexion. So it's really good at getting the curve back. And remember, at the end of your care plan, you want to take that post x-ray and see a nice improvement. All right, so you'll get one of these when you start. And the beauty of this is you can just adjust the tension on this. You can feed it through here and make it more tight or more loose, okay? It's a real simple device. Now the key is this. This is gonna be the pivot point for your neck. So if you feel like the back of your neck, you'll feel an area around C7. It sticks out a little bit more, like right here. So I know I want that to line up with this. So I'll show you. If you get on the floor, get centered to the device, and then really just kind of wiggle or work your way down, and right about there. Now, this is where my voice is going to sound funny because it's going to be back like this, but let your head just rest off the back of the device. Keep your knees bent and take pressure off your lower back. And as long as this position doesn't cause any increased pain, burning, things like that, we're okay to move forward. If it does, we gotta wait on this, okay? But it should be relatively relaxing, but it's gonna stretch the front of this as well. So if we're good here, great. Now we're gonna grab this, and it should just add a little bit of tension and hold your head back a little bit more. So now I have a little bit more extension in my neck. Now, first week, you try to do this for 2 minutes. So put in some headphones, listen to something, I don't know, read upside down if you want, it doesn't matter. But keep track for about 2 minutes. Try not to fall asleep on this thing. I've had a few patients do that. All right, now my 2 minutes is up. I'm gonna take this off, and here's what's key. Use your hands to support your head as you get up. Because if you try and get up too quickly after being in that stretched position like this, you're gonna strain your neck, and that's counterproductive, all right? So you're gonna just kind of baby yourself, get up nice and easy, and then you'll be good. Or if your back hurts, whatever, you can't do the sit-up, you just lean over to the side and get up like that. So you wanna do this at a minimum of 3 days a week. Ideally get into the habit of doing it every night. And then each week, I want you to try and up by 2 or 3 minutes. So you get to a point where you can tolerate a good 12 minutes on this thing. If you do that, and you're getting in for your visits, we should see a pretty good improvement on that cervical curve. All right, so that's it for today.